A selagion is an inflammatory benign growth that originates in the sebaceous gland of the eyelid. Surgery is required to excise this nodule from the tarsal plate. A cura is often used to remove this selagion content, and suturing is not required. However, a pressure dressing might be applied. Entrophin is an abnormal inversion of the eyelid. This inversion causes the eyelashes to irritate the cornea and usually involves the lower eyelid. The goal of surgery is to correct the anatomical precision by resection of the tarsal strip. Ectropion is an abnormal eversion or turning outward of the lower lid that creates an overflow of tears and exposes the conjunctiva, which becomes dry and irritated. Correction is achieved by tightening the lid. A pterygium is a benign growth of the conjunctival tissue over the corneal surface. It is a patch of degenerative elastic tissue that usually grows slowly, except in patients who live in the southern climates where it grows more aggressively. To prevent the pterygium from reoccurring, treatment with mitomycin or an excimer laser may be required. The cryocystorhinostomy, also called a DCR, is the creation of a permanent opening in the tear duct for drainage of tears. This procedure can be done open or endoscopically. Dacrocystis is inflammation at the lacrimal gland, causing pain, redness, and swelling at the site of the medial canthus. The lacrimal duct may be centered with silicone tubing, which is passed into the nose. The tube is then passed down the nasolacrimal duct and retrieved under the inferior turbinate. Lacrimal probing is done to remove an obstruction. A series of probes increasing in size are introduced into the duct system to increase the drainage of tears. For an infant, a lacrimal duct dilation will be performed to open a blocked tear duct. Muscle resection and recession is done to correct a strabismus, the inability to coordinate the eye muscles. Resection is a shortening of the eye muscle to pull the globe into the correct position, and recession is when the eye muscle is moved back to release the globe. A bridle suture can be used to rotate the globe and stabilize it. During this procedure, traction on the muscles can cause vagal response, which can result in bradycardia. If this occurs, the surgeon temporarily releases traction on the muscle until the heart rate returns to normal.